Hello junior medics. Today's topic is close to my heart, wrist X-ray interpretation. It's a skill you'll use throughout your medical career, from the emergency room to orthopedics. Why are wrist X-rays so important? Well, our wrists are complex structures. They're made up of many small bones, ligaments, and tendons. This makes them prone to injury, especially from falls or sports. Being able to quickly and accurately interpret wrist X-rays can make a real difference for your patients. It helps you diagnose fractures, dislocations, and other problems. This means you can start the right treatment plan sooner. So, put on your imaginary X-ray vision goggles and let's get started. Before we can interpret X-rays, we need to understand the anatomy we're looking at. Think of the wrist like a jigsaw puzzle. It has 8 small bones called carpal bones. These are arranged in 2 rows. In the row closest to your hand, we have the scaphoid, lunate, triquetrum and pisiform. The second row, closer to your forearm, contains the trapezium, trapezoid, capitate, and hamate. Remember the names and positions of these bones. It's crucial for accurate X-ray interpretation. We'll be referring to them a lot. Getting a good X-ray is like taking a good photograph. You need the right positioning. For a standard wrist X-ray, we usually take 3 views. Postero-anterior, PA, view. The patient places their hand palm down on the X-ray plate. Lateral view. The patient keeps their hand palm down but rotates it sideways so their thumb is pointing up. Oblique view. This is taken at a 45-degree angle with the hand placed palm down and slightly rotated. Each view gives us different information about the bones and joints. That's why we need all 3 for a complete picture. Section 4. Different angles, different views. PA, lateral, and oblique views. Now, let's delve into what each view shows us. The PA view is our go-to view for seeing the carpal bones, the radius, which is the bone on the thumb side of your forearm, and the ulna, the bone on the pinky finger side. The lateral view is excellent for assessing alignment. We can see if any bones are shifted out of place. It also gives us a good look at the carpal tunnel, a narrow passageway in the wrist where the median nerve travels. The oblique view is particularly helpful for visualizing the scaphoid bone, which is commonly fractured. By comparing these 3 views, we can build a 3-dimensional understanding of the wrist structure and identify any abnormalities. Section 5. Reading the clues. A step-by-step guide to interpretation. Now, for the exciting part. Interpreting the images. Here's a step-by-step approach. First, check patient details. Always start by confirming the patient's name, date of birth, and the date the X-ray was taken. This might seem obvious, but it's crucial to avoid potentially dangerous mix-ups. Next, assess image quality. Make sure the image is clear and properly exposed. Can you see all the bony structures? Are there any artifacts that might obscure important details? Then identify the bones. Use your knowledge of wrist anatomy to identify all 8 carpal bones, the radius, and the ulna. Trace their outlines with your eyes. Look for alignment. Pay close attention to the alignment of the carpal bones, especially in the lateral view. Are they in their correct positions, or do any appear shifted or overlapping? Assess joint spaces. the spaces between the bones should be relatively even. Narrowing of a joint space could indicate arthritis. Look for fractures. Fractures appear as breaks or disruptions in the normal smooth line of a bone. They can be subtle, so look closely for any irregularities. Finally, evaluate soft tissues. While we primarily focus on bones, don't forget to glance at the soft tissues surrounding the wrist. Any swelling or abnormal shadows could indicate ligament or tendon injuries. Remember, practice makes perfect. The more you look at wrist X-rays, the better you'll become at spotting subtle abnormalities.